Welcome to Improving Client Engagement, a product of the Rhode Island State Innovation Model with funding from the United States Department of Health and Human Services, Centers for Medicare and Medicaid. This video training includes 3 modules developed to support direct work with clients impacted by behavioral health challenges. Upon completion of all 3 modules, participants can take an online quiz provided at the end of Module 3. Participants who score 70 or higher will receive a certificate of completion.
So acceptance and commitment therapy, or what's referred to as an acronym ACT, A-C-T, is really the third wave of behaviorism. And we say that because it's very much like cognitive behavioral therapy in many ways. However, there are some important differences. And one of those differences is that ACT really includes mindfulness as part of the intervention. And mindfulness is really about being present-focused, open and receptive, and non-judgmental. So putting ACT into practice has its challenges like any other intervention or any other kind of therapy. However, really when you think about it, if we're open and receptive, non-judgmental, and present-focused with our clients, that naturally leads to client engagement and a better sort of therapeutic alliance. It's also really good because then not only do you build the alliance and the engagement, but it has a whole host of sort of skills and particular interventions and strategies that really help improve the quality and quantity of our life.
Improving Client Engagement, Module 3, Acceptance and Commitment Therapy, or ACT, an approach to treatment. Learning objectives. After completing Module 3, you will understand the role of ACT in supporting a client's effort to maintain behavior change. You'll be able to define the mechanisms of addiction and the role of ACT in supporting behavior change, and you'll be able to identify and describe the 3 components of ACT intervention. Acceptance and Commitment Therapy, or ACT, is a type of behavioral therapy. You may have heard about cognitive behavioral therapy, or CBT, a popular treatment approach for people struggling with addiction, anxiety, and depression. Both of these approaches, ACT and CBT, focus on how our internal thoughts and private experiences are related to and affect our behavior. ACT versus CBT. There are important distinctions between ACT and CBT. The goal of ACT is to enhance a client's ability to attend to and experience difficult thoughts and feelings. The goal of ACT is to develop a willingness and ability to experience distressful triggers and cues without having them result in reverting to unhealthy behaviors such as alcohol and other drugs.
So this is how I use ACT intervention in my private practice. Basically, I have specialty in addiction and behavioral medicine. And so there's a lot of opportunities for me to work with clients to really understand what's really underlying the difficulties that they're experiencing and sort of making the change that they may want to live healthier, more prosperous, and more fulfilling lives. And from an ACT perspective, we really talk about avoidance. Specifically, it doesn't feel good to have physiological withdrawal symptoms. It doesn't feel good to be depressed. It doesn't feel good to experience anxiety symptoms. So from an ACT perspective, really what we want to do is help people really build their tolerance to those symptoms. You want to help them sort of develop the capacity to sit with and be present with the angst or the uncertainty or the uncomfortableness about being anxious, depressed, or a physiological craving for drugs or alcohol. And in that way, you really enhance their capacity to, and their sort of self-efficacy to be tempted or to have urges or to have cravings and still make a choice that's actually healthier for them to meet their goal.
The mechanisms of addiction. Learned behavior. ACT is a helpful treatment approach that encourages us to ask important questions like, why do people use? In ACT, addiction is maintained by 3 specific mechanisms. Understanding these mechanisms helps clients understand how to manage change, even in the face of triggers. The first 2 mechanisms are not unique to ACT. However, the third mechanism, learned behavior, sets ACT apart from CBT and other types of treatment. It's kind of like flicking the light switch on in your house when you need a light. You don't really think about it because it is so well learned that we must learn a person's pattern of use so that we can change the environment to weaken the old patterns and start building new learned behaviors. Addiction is a combination of physiological and psychological factors driven by the 3 C's: compulsion, the obsession with alcohol and other drugs, lack of control, the inability to stop using or cut down from alcohol and drug use, and consequences, continued use despite adverse consequences. Manage distress. It doesn't feel good to feel bad, uncomfortable, upset, or angry. Alcohol and drugs can temporarily relieve those feelings, but this is just a short-term fix for a long-term problem. ACT helps the clients learn to deal with distress without relying on alcohol or drugs to cope. Intervention strategies. ACT involves 3 intervention strategies known as the 3 A's: abstain, alter, and alternatives. Abstain, whenever possible, do not use. Alter, change your minute-to-minute and daily routines. For example, learn behavior habits, associations, and pairings. And alternatives, be prepared with substitutions and refusal skills.
So the clinical work that we do is really valuable, although it definitely has its challenges. And why ACT can be so helpful is because in working with our clients and helping them become more present focused and open and receptive to the thoughts and feelings and the inner sort of workings of their mind, also as clinicians, ACT is very helpful because it helps us reflect and be more open and receptive and present focused about the thoughts and the feelings that we're having about the clinical work that we're doing. Maybe some of our clients are stuck, they're not making their goals, maybe we have other issues that are sort of we ourselves are going through. And so what ACT can do is really provide a platform for us to sort of reflect and be open, and that's can be a real helpful clinical tool to work with our clients, but then also to work with ourselves so that we can reduce sort of some of the burnout or maybe some of the compassion fatigue and have a better understanding of changing behavior is really difficult. And so we have these interventions, we have these strategies, but understanding that what we're going through and what is very similar to what our clients may be going through, and we can use that as actually a point of entry to have the discussion with people to help them achieve their goals. Throughout this training video, you've heard from me as well as several of my colleagues about how we each use Transtheoretical model, motivational interviewing, and acceptance and commitment therapy as specific tools and strategies to enhance client engagement and improve treatment outcomes.
Module 3 exercise. This exercise allows participants to continue to build on the concepts learned about the Transtheoretical model and motivational interviewing by making connections with the role of ACT in supporting behavior change, the mechanisms of addiction, and the intervention strategies. Turn to pages 19 to 24 in your participant manual to complete the practice exercise. Answers to this exercise can be found on pages 29 to 37 in your participant manual. What you have learned. The word cloud captures all of the terms learned in Module 3. Now that you have completed Module 3, you can consider ACT as a treatment option or referral for clients. Understand the mechanics of addiction while building strategies to prepare and support the client's behavior change. And explore supports for clients engaged in change through the 3 A's. Training certificate. Now that you have completed all 3 modules in the Improving Client Engagement series, you are eligible to take the online quiz. When you successfully pass the quiz with a score of 70 or better, you'll receive a certificate of completion from the Institute for Education in Healthcare. A link to the quiz can be found on page 16 in your participant manual.